Hey folks, and welcome back to COVID Chats. My guest today is Ira Seidman. Ira is a good friend of mine and graduate of Stevens University. He is currently out in Madison, Wisconsin, and is in the process of starting his own business. In the comment section below, you can find links to his website and relevant social medias. Now, without further ado, here is episode 16 of COVID Chats. Hello, Mr. Seidman, and welcome to episode 16 of COVID Chats.
Hello, Ruben. Thank you for having me and all that you do on this channel. It's a lot of good content, and you're
Thank you.
documenting history. So
Thank you.
keep up the good fight, the good
Yes,
work.
yes, I will. Yes, of course, you are highlighted on my YouTube channel quite a bit. We've had a video podcast together and a short film for the ages. Recently celebrated its 1 year anniversary, so that's very exciting.
Just to be upfront with the audience about
Yes.
any previous entanglements we may have had.
Yeah, there's some collusion here. So jumping forward now, I kind of want to just start off with it's been a week since my last COVID chat. I took a little break for Passover. I'm wondering how you doing?
I'm doing all right. Just for any viewers who don't know, which is probably all of you, I live in Madison, Wisconsin. I moved out here a little over a year ago, and I am we're in quarantine basically. It's not lockdown, there's no mandate. There's certain restrictions for large parties, like I think gatherings over 10 or 15 people are prohibited. So like my cousin had a wedding that got canceled and stuff like that. But for the most part, it's just like encouraged to stay home, work from home, stuff like that. I was working at Epic, but I left right before this whole Corona thing broke out. And now I'm trying to start my own business. So I'm in those super early days with that. And I think we'll get into that a little bit later. But generally, I'm doing all right. In quarantine, it's kind of boring, it's like, it's not super exciting, being in quarantine. It's not a party. It's okay though. I'm pretty busy. There's a lot to do, a lot of logistics with starting a business. So it's not like I have nothing to do. And I'm reading, I'm learning Spanish, I'm playing the piano, I'm working out. I keep myself busy.
Sure.
But generally, just the whole thing of not being able to go out, or I don't feel that comfortable just going out and spending all the time, like in the park or whatever. I go out at off hours, and I try to limit that. But generally, it's pretty boring, the whole having to be in quarantine.
Yeah, I think a lot of people are grappling with that. What they did with their time previously, what are they supposed to do with their time now? Kind of staying sane through all this has certainly been a challenge. You mentioned before that there aren't such strict restrictions, and at least in terms of Madison and Wisconsin. Our bars and restaurants are closed, though, correct?
So there are.
No?
So the bars are closed for sure.
Okay. No bars.
I mean, there are restaurants. I just went to Chipotle.
And you sat inside, or you took takeout to go?
I took it out. I don't know if there's any dining in, but I can't say that there's been like a restriction passed. Not entirely sure.
Interesting.
Which is something else. I don't know how that would be communicated to me. I know some of my friends are on Twitter. You can follow like the city of Madison on Twitter.
Yeah.
Or, you read the news or whatever, but I'm not super up to date on Wisconsin politics and stuff like that.
For sure.
In fact, we had an election last week, which...
Right. That was big news, the primary.
Big news, and it was a total mess. Because it was just so poorly communicated what was going on. Like, I got an absentee ballot because I figured I don't want to have to go to the polling station.
Makes sense.
And that came like maybe the Thursday before, and we voted last Tuesday. So I sent it in on Saturday, and then there was something about it has to be in by the election day rather
Right.
than postmarked or something like that. So
Yep.
that was a little uncertain. And then the night before, the governor said, like, we're postponing just like all the other states because we don't want people coming out.
Right.
And then the Supreme Court overruled that. So like on election day, I told my friends, like, I'm pretty sure it's postponed. You don't have to go. And they're like, no, that got changed. It was just very disorganized.
Right.
People were forced to come in and line up. There were like pictures of lots of people with masks. It's just
Right.
not the move. Just doesn't seem like the most responsible way to run a primary.
Yeah.
But all that's to say, like, there are decisions being made at high levels, and I don't think there is a clean way that this is being communicated. I don't know about in other parts of the country if that's better.
That's been a theme for most of my conversations, even globally, is that, although globally it's a little different, but the dissemination of information has been very, very poor, and different people are finding out about different things from different sources, which, I mean, is also sort of how things were before this. It was just less critical news. This is kind of news that everybody needs to know, as opposed to like, oh, I want this news, oh, I want that news. Like, it would be better if there was one clean, maybe government service of some sort that could get out what you needed to know. Like, I've only gotten one alert on my phone, and it was from New York City about health officials and if anyone could volunteer and things like that. But I'm surprised there hasn't been more use of the government cell phone power. I don't know exactly what the
yeah,
terminology for that is, but they could be sending out this information to people so we could be informed.
I mean, when I haven't gotten that many alerts at all since I moved to Wisconsin, but I remember like when I was in the East, I would get alerts about the most random things, flash floods and
Yeah,
like, you know,
child alerts, Amber
Amber
Child.
alerts, stuff like that,
Right.
like serious stuff. But
Yeah.
if you're
Right.
gonna use it for that, you should use it for this too.
Yeah, yeah. I'm surprised it hasn't been used for this in that regard, but certainly been a theme, across governments, even across higher education facilities. Been a lot of mixed signals, mixed information, things changing one day. And granted, at the beginning things were moving so quickly. I think it was hard to get out a unified message. So I do have some sympathy in that regard. But at this stage, it feels like we should be getting there should have been more preparation, especially in the Wisconsin primary example. 4 weeks into a quarantine, like they know what the situation is currently. There's no reason it should be changing hours before, hours after.
Right. And I know this particular program is kind of like meant to be a slice of life, and I don't want to take it too broad and like
Go
go down
for
the
it.
political rabbit hole.
Yeah.
But the political rabbit hole has really, screwed up my slice of life. So I'm gonna just scoop it in there a little bit. I think, it's up for discussion about what the role of government in a time of crisis like this is and how far they should reach. And that's a fair discussion to have. But the number one thing that the government needs to be doing is being clear about what is happening, give as much information as cleanly as possible and the right information.
Mm.
And the government, like, it's both sides too. I mean, I'd say Trump is the worst example, and he continues to, even now he wants to reopen the economy. He's
Right.
just pushing all these really irresponsible measures. But the biggest issue is like just being a merchant of doubt
Mm.
and letting people think that it's okay to go out and we don't have to social distance and things that the scientists are guaranteeing us will work and are showing us that they work. And
Right.
he's casting doubt on this in times when we need to be extremely clear about what we should be doing.
Yeah. It is
So
troubling.
in that sense, things are a little, as far as my experience with that, I basically don't listen to the politicians. I try to just read like what the scientists are recommending and read as much on my own to see what the recommendations are. And for me, it just sounds like my job right now is to stay home and not spread this in any way that I can or
Yeah.
get this. Because the more that we limit our exposure and the way we spread it, the less everyone else is exposed, and eventually that, we have enough herd immunity. That's in the long term, and we can get back to normal. But in the short term, that's how I sort of view my role in this.
Yeah. I think staying home, that's kind of the number one thing we can all do if we're non-essential. There's no need to, do anything frivolous, any additional grocery shopping that doesn't need to happen, any jog outside that's not, that one jog of the day or whatever. Yeah,
Right.
that's certainly true. So, you touched upon starting a new business earlier on at the beginning of this conversation. I'm curious, can you tell us a little bit about what that business is and maybe how things have shifted with it in light of this crisis and recession of sorts?
Are you asking me to plug my business?
I'll take a plug. I'll take a plug. I
Okay,
think
I'll
I
give
think
a
for the
plug.
sake of delving into the elements that will affect the business, it will be important to understand the business a little bit. So
Sure. So, yeah, I'm starting a conglomerate basically. It's not just one business. It's like a
right,
whole wide-ranging assortment of businesses that I think are missing and need to be started and I'm passionate about. So, on the like smaller level, it's a line of graphic t-shirts. It's an app for the App Store about public transit updates and a garbage bin that doesn't need a garbage bag. Those are like the three projects that I'm actively working on and hope to be selling by the end of the year. But then the larger picture is sort of the assortment of these businesses and hopefully partnering with other entrepreneurs and other businesses to have something of like the alternative to Amazon, but for sustainable retail.
mm,
So I know when I shop, I always do a lot of research, like who's legit, who's not. It's tough to like decipher what's good marketing and what's actually, like a sustainable product where they're,
sure.
you know, they have certain certifications and it's a lot of work. And it'd be nice if
Yeah.
everything was just in one spot. So that's sort of like the long vision of where I hope to be eventually.
hmm
Um, but in terms of starting this, I just really got the ball rolling on all of this a couple months ago, mid-February. So I'm kind of lucky in the sense that like I just have to stay home and work on things. There's so many things that need to be done. Like
Right.
the ball is not in anyone else's court. I'm not waiting on people who aren't in office or something like that. Like I have plenty to do.
Mm,
The only real inconvenience I've sort of had was I tried to open a bank account for my business and like the banks, a lot of them are closed, so only a
right.
couple branches are open, and those were a little inconvenient to get to, and their hours were, you know, half what they used to be.
Right.
But other than that, I can't really think of anything that stopped me from progressing or
Sure.
hindered me from this pandemic, which is kind of lucky.
Yeah.
But in the long run, like I definitely once I start selling, I hope to be at markets and like different face-to-face venues and
Right.
expos and stuff like that. And those are cooked for
Yeah.
the time being. So depending on
Exactly.
how long this runs, that could affect me relatively shortly.
Yeah. That was something I was going to bring up is that, right, maybe in the short term, there's nothing too drastic. Most of what you need to do, you can still do from your home, from your laptop. But yeah, no, come, I mean, who knows exactly how long these social distancing protocols will be in place, but certainly, selling at a farmer's market or, concerts, it looks like there's some articles, they're not going to come back until next fall, like real big concerts and things like that. So certainly that would be an issue, but that's just on the marketing, face-to-face selling end. There's still all the other elements of it that seem fairly undisrupted.
Yeah. Um, when you say next fall, do you mean like 18 months out or?
That's what a recent article I read about concerts was saying.
Yeesh.
Yeah, and I mean, those are, if I'm thinking about concerts, I'm thinking about bigger, sort of stadium events, 30, 40, 50,000 people. I mean,
Sure.
all those people in seats are standing right next to each other. I mean, it's so weird because it's something that was such a staple of society, especially American Western society. And now that that's not there, everyone's been waiting for it to come back. And there's all these groups of like, oh, is summer tour happening? But it's like, summer tour is definitely not happening. And fall tour might not be happening either. But yeah, so.
Yeah. So, I mean, that's something I'm just like a lot of the selling to
Yeah.
come. I'd say I have to do live. Madison has, I think, the biggest farmers market in the U.S. Every Saturday, it's two like it's basically 8 blocks worth of farmers.
Whoa.
And yeah, it's a huge farmers market, and everyone comes out. They're like musicians playing. It's like great time and like ton of people happy to sell and happy to buy. So that's like I don't think that would be happening anytime soon. Maybe by the end of the year. I don't. Tough to say. So that adds uncertainty. But like you were saying, it just means I have to adapt a little bit and lean
Yeah.
into online marketing or, you know, mix it up to get the word out.
Yeah. I mean, honestly, you can probably think of it as sort of your first roadblock in the business, right? Like, and it's luckily it's not such a big roadblock at this time, and you have plenty of more time to prepare for, working around it, as opposed to something that stops production of everything, like a factory being shut down or something. So
Yeah, I would imagine if I was starting a business with employees and we just opened like a restaurant,
yeah,
if I had opened a restaurant in like March and then I had to close, lay people off, I still have rent obligations, stuff like that.
yeah,
That'd be a whole different story.
yeah.
Um,
Yeah, the restaurant industry and the resilience there will be very interesting. We'll see what kind of bailouts they get. Even the first payments to individuals and small businesses has been pretty shoddy and a little unpredictable. I don't know if you've gotten your check yet. Uh,
I haven't got my personal check yet. I don't know. Again, I don't know when I would get that or how I would be notified about it. If it'll just appear in my bank account.
I'm not. I think it depends if you've had like direct deposit set up with the government in terms of like tax returns and things like that. But it's certainly, you're right. The information on it has not gotten out well. So how have you sort of adapted and adjusted to this new way of life? I mean, you mentioned being bored earlier. You also mentioned doing some productive things. Do you think, how else have you sort of changed, either physically, emotionally, mentally? What else have you seen changes in now that we're 4 or 5 weeks in?
Um, well, for the good changes, I have like recurring Zoom meetings with both my friends and my family, and I'm seeing people regularly who I have not seen regularly ever. So that's exciting. Um, I'd say that's probably the best part of quarantine. The the less ideal, I mean, definitely not getting that much sun. It was snowing today in Wisconsin.
Wow.
It's the weather's still not great anyway. But like once the weather's better, obviously it'd be nice to go out, but that's gonna be a bummer. Um, Emotionally, uh,
Mood.
it seems fine enough, like I'm a little bummed about like it'd be nice to go out with my friends and like definitely it feels isolating, but I
Mm,
think that's the point.
yeah.
So I mean, I get that this is no one's fault and it's just the way it's got to be.
Yeah.
Um, but for me, I think like a lot of the focus is just like there's so much to do for my business.
Yeah.
That's sort of keeping me occupied, and that's where most of my focus is these days.
Yeah, I think it's important to sort of keep yourself busy with good things, not just give yourself busy tasks to try to, pretend like the world isn't different. I think once you've recognized that things have changed, yeah, you can sort of go back to a schedule that, maybe somewhat similarly resembles, life before pre-corona. And you can do that in a positive way. I think it's dangerous to try to. I think some people sort of fill their time, and I was finding myself maybe a little bit like this at the beginning of the outbreak, but trying to do things that would make it feel as if things hadn't really changed, even though they very very much so had. And I think it's kind of important for yourself to really just address that. Yeah, it is really different, but we can still be productive, and we can still focus on the things that need to get done. And in your case, a small business, right? These things need to get done regardless.
Yeah. Sure.
So shifting a little bit, I know you're keen on solutions, and I saw some Facebook posts earlier on about potential solutions to the coronavirus to try to, mitigate further damage. I'm wondering, where do you see those solutions now, and are there any new ideas you have for this, either helping restart the economy, solutions about when to reopen, solutions about how to reduce infection?
Yeah. So I haven't formally thought about this in a couple weeks. So it's sort of a moving target, but I think a lot of those ideas I had before still apply. And then you and I can maybe chat out, some of the newer ends.
Yeah.
Um, but I think testing has to be way more a part of the solution. Like the countries that have some of the lowest spread rates are the ones that tested the most aggressively.
Right.
And part of the issue is the asymptomatic spreaders. So if people don't even know they're spreading it and they never even knew they had it, how many people got it from them? And, that could have been prevented. So some people say, well, we all should just act like we have it. And that'll be the solution. But if you have coronavirus, if you have COVID, like you're taking way more precautions than, like, it is a huge, on top of just being in self quarantine, like you're supposed to be in your own room, you're supposed to have your own bathroom, you can't be like cooking your own, you can't be cooking with other people. I live with 3 other guys. There are like a lot of things that we're sharing, bathrooms, and like if one of us had corona, I don't want to be cooking in the same kitchen with them. But that's a huge change in all of our lifestyles we'd have to make if we all acted like we all have it. So I think it'd be just much better if we were aggressively testing. One of my roommates like got a cough and had like some other symptoms a few weeks ago, and it was like pretty uncertain, but it went away pretty quickly and none of the rest of us got it.
Right.
At least that same cough. So potentially we don't even know. Maybe we all have corona and we and so that's my point. It's like we should be testing for, even if you don't feel sick, just know that you can go get tested.
Yeah.
And then the antibody test will be huge so that the people who have had it and now are okay, they can go back to work. They'll be like superhuman healthcare workers who can just treat corona, yeah, they don't even need the mask. It's all good. So, I mean, that we should be aggressively pushing the vaccine, more clear information, just to like, even just one Twitter feed or something that's like super reliable. The leaders need to be deferring to scientists and specialists at pretty much all times. Like politicians have basically no role in this at this point. They should just be deferring and getting the right people in front of us to make things clear.
Well, I mean, isn't the politician's role in some way to hear what the scientists are saying and then sort of enact that in a public way, i.e., shutting restaurants down, shutting bars down, things like that? The scientists can't do that, right? I mean, they're the ones crunching the data and looking at the patients and.
Right. So if like an actual law needs to be passed or a mandate or whatever, that has to come from the politicians. But other than that, like we should be, for the most part, they shouldn't be saying anything. They should just be putting the right people in front of us who are experts and we can hear it from them and we'll all respond accordingly. And I think that's sort of like, that's not the way it's being done right now. It's like, I know Andrew Cuomo does like a daily address and, Trump does a daily address. They're doing daily addresses, but like, we don't really need to hear from you. We need to hear from experts is sort of my point.
I got you. I mean, Cuomo generally does his address with, a couple doctors on hand, and then people have a lot of questions for him in terms of, I mean, one, policy has been doled out in terms of mandates to stay home and things like that, and fines if people are out and gathering and things like that. And I think people have a lot of questions for Cuomo in terms of, the big question on everyone's mind is, when are we going to start restarting things? So I think politicians have a larger role than you might be addressing. I do certainly understand the focus on scientists, and we need that hard data that's proven and backed up to make these decisions. But decisions must be made. Both, they had to be made earlier on in terms of shutting things down, and they're going to have to be made in terms of restarting things, because there is a cost benefit of waiting too long and opening up too early.
Yeah, no, that's a great point. And they do have to be a part of the solution, but what the politicians are saying should basically be equal to what the scientists are saying in consensus. So if there's some disagreement, maybe the politicians have to, get the team together in such a way that we're pushing forward with a unified force.
Yeah.
But, if the state of New York is implementing fines, that should come from the scientists saying we shouldn't have people out, and B, some kind of data that says this will be effective. And the politicians should just be a vessel at that point to pass along what experts have agreed is the best way to deal with this. That's what I would say. But politicians have their own role to play. So they have their own skills to bring to the table, and they should be part of it. But
yeah,
I think a lot of our leaders are just talking indiscriminately and spreading, ideas that are just confusing, and that's really hurting us.
Yeah, I think it's also just an element of America, in the government system that we have. We obviously have federal guidelines and regulations and laws, but we also have a lot of state power, and certain states haven't really put any restrictions in place in terms of shutting down social things. I think Louisiana is one of the most loosest mandates in terms of any kinds of restrictions on social gatherings and things of that nature. So I think we have a difficult time with a unified front when so many people rightly and justly defend states' rights and sort of America as an individualist society, and people want to make the choices they want to make, don't infringe on my freedom. And we mock it a little bit, but it's also something that we hold pretty dear as Americans. The idea that we can pull ourselves up by the bootstraps, and that we only need us, and we don't need the damn government, with their welfare state, But I obviously, I'm joking a little bit, but I do think that's in some ways what's made it so difficult to disseminate clear, unifying, abiding information about this, which is unfortunate.
I'd say that's what we need the most in a society where the powers are so dispersed, and the role of government is so strictly undefined. What we need the most is good information, and that's what the government can provide. They don't need anyone's permission to the federal government's doing this and the state. No, everyone has the right, and I would say the responsibility, to spread good information at this time.
Yeah.
And that's what we've seen the least of.
Yeah, it's definitely, it's been hard. As someone in New York who listens to Cuomo's address fairly frequently, I think that he's done a good job, and I think New York as a whole has done a good job, even though, at this point we have more cases than Italy. But I think that's also just an inevitable facet of New York, people living in such close proximity to each other. Mm-hmm. There's just, and the huge factor of the asymptomatic people with this disease. There was almost no way that New York wasn't going to be this disaster that we've seen. Could it have been not as bad had things been shut down earlier? Sure. But there was almost no way this wasn't going to spread like wildfire, right? Just sort of a factor of the disease. And it's something you mentioned before. There's not really necessarily one person to blame, which makes it tough. You also mentioned earlier you live with a couple roommates. So I'm curious, what's what's that been like? Have you found yourself sort of being a watchful eye over them? Like, hey, you washing your hands? Like, because it's true, you
Um,
guys you're living together, you're cooking with similar dishes, similar bathrooms. I mean, it's almost like they're your family, they're kin. So, I'm curious what that's been like.
yeah, it's close quarters for sure. It's I mean, we're sort of reliant on each other to a certain degree, like um I mean, like if one of us gets sick, the other two are most likely gonna get it, because it's gonna take a couple days for us to know, and we'll have been like we one of my roommates makes a funny joke, like when we're both in the kitchen, he's always talking about the 6 feet. So like, we're not totally just hanging out together. We're not throwing parties and stuff. And
Right. Good.
we are in close proximity, and it's most likely that we'll all get it if one of us gets it. So we're sort of relying on each other to that extent. And then just another, like factor to weigh in is that, like, if one of us gets it, the other two don't really have anywhere to go. So there, as far as I know in New York, maybe they have like some hotels where you can sort of check yourself in. I'm not really too up to date on those details, but for the most part, like, you're supposed to just stay home. But if your home is infected, it'd be helpful to have somewhere where you can, get out if you need to.
Yeah, a corona safe zone of sorts.
Yeah.
The issue is people who are asymptomatic could go there and then spread it in the safe zone, and then the safe zone's infected.
That's why we got to test.
Right, we got to test. Yeah, I think that was something I even mentioned very early on when this was all going on, when there was so little testing. It was like, we're just gonna have to test everyone. And I think someone mocked me. They were like, test hundreds of millions of Americans, like, it's not feasible. And it's like, it's necessary. It's not a question of what's feasible at this point. Like, you're gonna make it. We got to make it feasible.
Yeah.
Especially in the case of having roommates and living in close quarters, it'd be great if they could be tested so you could be relieved and or very worried.
Yeah. And I would say more than just test all Americans, we should be tested regularly. Not every day, like every week, something like that. Because, this thing's a moving target. So just because you get one test.
That's true. And it does seem like it's going to hang around for a while. Based on what I've heard from the scientists, it seems like basically whenever this vaccine is, sort of finalized, we'll essentially need it in the same and similar way that we need to get a flu shot and we need to get a tetanus shot every 7 years. Like, it's not going away. We'll find ways to, prevent it from spreading every winter. But just going to be another thing that we deal with.
Interesting. Another thing on the list.
Yeah. Chalk it up there with all the other vaccines we have. Yeah. Bad time to be an anti-vaxxer, I'll tell you that much.
True that.
So any closing thoughts about how this has affected you, or things you want to say regarding COVID? Maybe predictions for how much longer this will go on. Obviously, you're in a particular circumstance, but
Yeah, just like huge thanks to the healthcare workers. Like, they are just, I've heard they have to work 100-hour weeks, or they're in a day. It's exhausting, it's dangerous. Some of them have died. So I know in New York you guys go crazy at 7 p.m.
Yep.
As you guys should. So I mean, there are no words to express like how brave they are and how much we need them right now. So hopefully this can be as close as words can get as my gratitude to them.
I like that. Yeah, I think they'll be treated similarly, maybe hopefully better than veterans, because veterans, of course, historically aren't treated so well, but maybe treated as well as active service members, I should say. Because, when you see an active service member, typically, well, thank you for your service, or you'll just sort of be in awe of the person, recognition of it. They sort of occupy a different kind of space. I wonder if healthcare workers will take on a similar status.
We can only hope.
You can only hope. I agree. Lastly, yeah, prediction. How many more weeks, months? What do you think?
Ooh, doing like an over/under kind of.
Sure. Any sort of potential statistical.
Is it like a COVID chats kind of lottery?
This
Does
is
one?
the first one I've done, so
Okay.
I don't want to force people into making a prediction that they don't want to make. So by all means, if you don't want to make a prediction, don't. I know people who are cautious about that kind of thing, and the virus has changed things so quickly. But why not? What's
Yeah,
wrong?
I'll give a prediction by all means. For basically the vaccine, for the end of this, as I would define it, is it an open-ended?
Whichever element you want to predict about, whether it be the end of quarantine, whether it be the restarting the economy, the vaccine, you choose.
So I don't have much expertise in this, but I would say I don't really want to give a time estimate. I'd rather give like it's going to be tied to something else.
Mm.
So, or at least it should be tied to something else.
Science-based.
So I would say we should reopen society or get out of quarantine when basically there's like a statistical certainty that our healthcare facilities will not be overwhelmed going forward. And right, like you see those curves of different sizes and we're all about flattening the curve.
Right.
Basically, once we're deep enough onto the curve where we know we're coming down and we can confidently predict the rest to be within our range, that's when we should reopen. And I don't want to give a time because I'm so unconfident in leadership,
right.
How aggressively they want to reopen and how much misinformation there's been. Like there's so much uncertainty on what that curve could be. There could be a second, peak. There could be all sorts of things with bad, judgment.
Yeah.
I can't really give a time, but I would say it should be when we are statistically confident that our healthcare system can handle anything going forward from that point.
I think that's fair. I think that's probably the best way to predict, right? Based on those scientific lines that you preached before, which I think preached for a reason, good reason. Those are kind of the objective facts in this case. Well, Mr. Seidman, thank you very much for being on COVID Chats. It was a pleasure chatting with you.
Yeah, likewise. Thanks for having me, and best of luck with the rest of your interviews.
Absolutely. I will stay in touch, and perhaps we'll do a follow-up if this goes on longer than either of us wanted to.
By all means.